If you've been on birth control for years, you might be missing crucial nutrients that could be affecting your energy, your mood, your metabolism, and even your hormones. And you've probably never been told about it. Women are put on the pill for everything from painful periods, acne, irregular menstrual cycles, and even during perimenopause while transitioning into menopause. But no one talks about what happens when your body is slowly drained of key vitamins and minerals over time. So if you're feeling more exhausted, struggling with weight gain, dealing with hair loss, or just feeling off, this could be why. And today I'm breaking down the 9 nutrients birth control depletes, why they matter, and how to fix it. So let's get into it. Okay, before we dive in, why does this even happen? Well, your liver works overtime to process synthetic hormones from birth control, and that uses up extra vitamins and minerals. On top of that, birth control affects your gut health, making it harder for your body to absorb key nutrients from food. So even if you're eating a healthy diet, your body might not be getting what it needs. And guess what? Most doctors never warn women about this. I know I didn't back when I was practicing conventional OBGYN, but now I know better, so I do better. So now I'm going to talk about the 9 key nutrients that take a hit when you're on the pill and why that matters for your health. Folic acid, also known as vitamin B9. Now, folic acid is crucial for DNA synthesis, cell repair, and making red blood cells. It's also essential for fertility and pregnancy. Birth control depletes folic acid. When your body doesn't have enough folic acid, it struggles to make red blood cells, which means less oxygen is getting to your cells. If you stop birth control and get pregnant right away, low folate levels can increase the risk of birth defects, especially neural tube defects, because folate is crucial for fetal development, even before you know you're pregnant. Why? Well, again, the birth control pill depletes folate, which is essential for proper brain and spinal cord development in a baby. Since these structures form within the first few weeks of pregnancy, low folate levels at conception can increase the risk of neural tube defects like spina bifida. That's why many doctors recommend taking a high quality folate supplement if you're coming off the pill and trying to conceive. And your liver relies on folate to properly break down and eliminate excess hormones. So when you're low on folate, your body's natural detox process slows down, leading to hormone imbalances and symptoms like bloating, fatigue, and stubborn weight gain. So how can you fix it? Look for methylfolate, not folic acid, methylfolate in supplements for better absorption. Then we have vitamin B6. Vitamin B6 is huge for regulating your mood, your metabolism, and even progesterone production. If you're low, you're more likely to feel anxious, irritable, or even depressed. Birth control depletes B6, which can lead to increased PMS symptoms because vitamin B6 helps balance estrogen and progesterone. Vitamin B6 is essential for making neurotransmitters like serotonin and dopamine, the brain chemicals that regulate our mood. When B6 is low, your body struggles to produce these feel-good hormones, increasing the risk of depression, mood swings, and anxiety. You can have weakened immune function because B6 is critical for your immune system. How can you fix it? Well, eat more vitamin B6 rich foods like salmon, bananas, poultry, and avocados. Or you can supplement with the active form of vitamin B6, which is P5P, also known as pyridoxal 5-phosphate. Then we have vitamin B12. B12 is non-negotiable for energy, nerve health, and your mood. If you're feeling exhausted, foggy, or just meh, this could be why. Since birth control can deplete vitamin B12, this can lead to things like chronic fatigue and weakness, numbness and tingling in your hands and feet, since B12 is crucial for nerve function, and low production of red blood cells, which is going to mean poor delivery of oxygen to your cells. So how do you fix it? Well, if you eat animal products, you're getting your vitamin B12. But just remember to prioritize grass-fed meat, eggs, and fish. And if you're plant-based, you will need to supplement with a B12 supplement, and I would recommend methylcobalamin, which is the active form of vitamin B12. Okay, if this is making sense and you're having a few aha moments, go ahead and tap that like button. It lets me know that you're loving this kind of content. And if you're new here, hit that subscribe button so you don't miss out on what's coming next. All right, next we have vitamin C. Now, vitamin C is a powerhouse for immune health, skin, and hormone production, but birth control uses up a lot of it. Low vitamin C can lead to things like a weakened immunity, so you're going to be getting sick more often. Vitamin C is essential for making collagen, the protein that keeps your skin firm, smooth, and elastic. When you're low in vitamin C, your body produces less collagen, leading to slower wound healing, more fine lines, and skin that looks dull or less plump over time. This is why women on birth control who are often low in vitamin C may notice duller skin, slower healing, and faster signs of aging. You can develop an iron deficiency since vitamin C helps you absorb iron properly. So how can you fix this? Well, eat vitamin C rich foods like citrus, bell peppers, and leafy greens, or again, you can supplement with a liposomal vitamin C for better absorption. Next up, we have magnesium. Now, magnesium is one of the most common deficiencies I see in women, even if you're not on birth control. But the pill burns through magnesium even faster. So low magnesium equals more stress and anxiety since magnesium calms your nervous system. Low magnesium means worse sleep quality since magnesium helps your body relax at night. And magnesium is a natural muscle relaxant. So when your levels are low, muscles contract more than they should, leading to cramps, tension headaches, and even constipation since your intestinal muscles also need magnesium to function properly. So how do you fix it? Magnesium glycinate is the best for sleep and relaxation, and magnesium citrate helps keep digestion moving. And a little reminder, I am a doc, but I'm not your doc. So if you choose to start any new supplements, please consult your own personal healthcare practitioner. Okay, next. At this point, you might be wondering, if birth control depletes all of these nutrients, how do you actually fix it? This is exactly what I help women with inside my private membership community. If you're over 40 and struggling with hormone imbalances, low energy, or stubborn weight gain, it's not just about taking more supplements. It's about understanding how your body works and giving it exactly what it needs to thrive. Inside, I teach you how to reset your metabolism, balance your hormones naturally, and start feeling like yourself again. So if you want real guidance and a strategy that works, you will love it in there. I'll drop the link in the description below if you want to check it out. Now let's get back into the final nutrients you need to be aware of. Next up, we have zinc. Zinc is a critical mineral for hormone production, immune function, and skin health, but birth control drains zinc levels over time. Low zinc levels can lead to a weakened immune system, so you find yourself getting sick more often and recovering more slowly from colds. You might develop acne and poor skin healing since zinc helps control oil production and inflammation in the skin. And you might notice that your hair is thinning since zinc is essential for hair growth and repair. So low levels of zinc equals more shedding. And you might notice a problem getting pregnant since zinc plays a key role in ovulation and reproductive health. So how can you fix it? Eat more pumpkin seeds, grass-fed beef, chickpeas, and oysters, and you can consider a zinc supplement, 10 to 15 milligrams daily, especially if you're on or coming off birth control. And remember, pair your zinc with copper if you plan on taking it long-term. Next, we have iron. Now, iron is essential for carrying oxygen through your blood, but birth control can reduce iron absorption and lower your levels over time. So if you have low iron, you might develop fatigue and weakness since your body is struggling to get oxygen delivered efficiently. You might develop dizziness or lightheadedness since low iron levels means low oxygen flow to your brain. You might have pale skin and brittle nails because your skin and nails lose color and strength when iron is low. And again, you might develop hair loss since iron is critical for hair follicles and deficiency can trigger shedding. By the way, have you noticed any of these symptoms, fatigue, brain fog, or maybe hair thinning? If you have, let me know in the comments. I love hearing from you and it helps me create more videos that actually answer your questions. Okay, so how would you fix an iron deficiency? Eat iron-rich foods like grass-fed red meat, spinach, lentils, and eggs. And remember to pair your iron-rich foods with vitamin C for better absorption. And if you want to supplement, choose heme iron because it's better absorbed, and avoid taking it with calcium, which blocks absorption. Okay, next we have selenium. Selenium is a powerful antioxidant that supports thyroid function, metabolism, and immune health. But the pill depletes selenium. And since men and women are already low in it, this can be a big problem. Low selenium means that you're probably going to have a thyroid dysfunction because selenium is critical for converting T4 to active T3, which is the active thyroid hormone that regulates your metabolism and energy. You might experience brain fog and fatigue since low selenium can slow your metabolism, making you feel more sluggish. And you might develop a weakened immune system since selenium helps fight inflammation and supports your white blood cells, which help fight infection. So, how do you fix it? Eat 2 to 3 Brazil nuts per day. These are one of the best natural sources of selenium and actually my favorite. You might also want to include wild caught fish, eggs, and mushrooms into your diet. And you can consider a selenium supplement around 100 micrograms a day if you are deficient. And then we have vitamin E. It's a key antioxidant that protects your cells from damage, supports hormone balance, and helps keep skin and hair healthy. And since birth control can deplete vitamin E, this in turn can lead to dry, dull skin and even brittle hair, since vitamin E keeps your skin hydrated and protects against damage. It can lead to a weakened immune system since vitamin E fights oxidative stress, so low levels can make you more prone to infections. And it can cause a hormonal imbalance since vitamin E supports progesterone production, which helps balance out estrogen. So how can you fix this? Well, eat more avocados, almonds, sunflower seeds, and olive oil. Or you can choose a natural vitamin E supplement, but you're going to want to look for a D-alpha tocopherol instead of synthetic forms. Okay, so now you know. Birth control doesn't just affect your hormones. It depletes essential nutrients that can impact your energy, your metabolism, and your overall health. If you've been on birth control long term, here's what you can do. Number 1, focus on whole nutrient-dense foods, especially the ones we talked about in this video. Number 2, consider targeted supplementation to replenish what's missing or what you're not getting in your diet. And number 3, support your gut health because nutrient absorption starts in the gut. And with that, we'll see you right back here next week. Ciao.